Good morning. See? Okay, I'm not the best cameraman. Good morning. We're at the horse farm this morning, and the girls only do usually one, occasionally two competitions a year. We decided to do the one competition this year in August. I believe it's the beginning of August. But we came this morning for just 15 minutes or so to walk the dog. Our dog loves walking out here at the horse farm, and there's a competition, so I figured I would show a bit of the jumping competition this morning and walk around and show a few other bits. But this is June 1st. The girls won't be doing their competition till August. I think it's August 1st that they'll be doing their competition. Sorry, I'm not sad today. My allergies are bad this morning. I forgot to take my pill. So I am very teary-eyed. Quite attractive. Let's see. So as the title indicated, today is day 3 on endometriosis. And yesterday and the day before, I spoke on endometriosis, so the detailed information is on those 2 days. Today I'll be probably wrapping it up. I can't think. As you guys know, I don't write these competitions out, but I kind of have in my mind what to say, so I don't think there's a whole lot more to say on endometriosis. So endometriosis is a disease or disorder where the tissue that lines the uterus, the endometrium, where that tissue is microscopically scattered throughout the pelvis and the abdomen. Sometimes it's macroscopically scattered. So sometimes you can see it, sometimes you can't see it. Show a little bit more competition. Sometimes you can see it, sometimes you can't see it. Because it's it's the tissue inside the lining of the uterus, the tissue, when stimulated by the hormones, bleeds monthly when you ovulate and when you're supposed to get your cycle, just like it would if it were in the uterus to give you a menstrual cycle. Unfortunately, because it's in the wrong location, that bleeding causes inflammation and it also causes scarring. So for women with endometriosis, the usual definition is that they have menstrual pain that is disruptive to activities of daily living. And because of that, they will usually report severe menstrual pain where, despite taking medication, they cannot function for a day or two. They're calling out from work or from school every single month for 1 to 2 days, occasionally 3. And then over time, because of the inflammatory activity and inflammatory changes, there becomes scarring. And that scarring can be quite severe, where now they have dysfunction of organ activities, sometimes bladder, often bowel, and they have pain not just with their menstrual cycle, but they have pain throughout the month. Apropos, I had a patient just yesterday, Friday, a new patient who came in, and she reported that every month, she said, I was surprised, but she told me that every month, I was surprised, she told me that she had been asking doctors whenever she saw a new doctor, and she said she's asked about 4 or 5 doctors and no one knew what she was talking about or what was going on. I was quite surprised, but she told me that every month with her menstrual cycle for probably about the last 5 to 7 years. Now, it hasn't been the whole time. She's 26. I think she was 26 or 27. She said that every month with her menstrual cycle, she has so much pain for the first 1 to 3 days. She can barely function. And that when she has a bowel movement, the pain is so severe, she she can hardly walk to get to the restroom. She has to double over, and it's very, very difficult to pass the stool because the pain is excruciating, and she just kind of pushes through and bears with the pain, but she tries not to have a bowel movement. Even though she's not constipated, she tries not to have a bowel movement for the first 3 days of her menstrual cycle because it's torture. So I said, well, difficulty passing bowel when you're not constipated, that's called obstipation. I don't understand how no one knew what she was talking about. And if it's severely painful and difficult, sounds like she has endometriosis and endometriotic scarring. I'm still shocked that she says 4 or 5 gynecologists that she asked couldn't tell her what was going on. So she was quite surprised when I explained what been explaining this week. It's kind of ironic that I'm doing the endometriosis discussions Thursday, Friday, and today, and she came in with clear evidence of endometriosis, inflammatory issues, and scarring that has developed over the last 5 to 6 years. So when someone has endometriosis, over time it becomes worse and worse because over time the inflammatory changes accumulate. In general, there aren't any risk factors unless someone has a mother or older sisters with similar symptoms. We know that about 15 to 20% of the population has endometriosis. It's predominantly the manifestation or the tissue changes are in the deep pelvic tissue, so we can't see them with the naked eye if we do surgery. But realistically, we always do an ultrasound or sonogram to see if there is evidence of macroscopic changes due to endometriosis. So if there is evidence of buildup of endometriosis. So what happens is if the endometriotic tissues accumulate or just over time and time, they bleed, what happens is you get a pocket of endometriotic manifestation, and that pocket is a pocket of blood. So a pocket of liquid we call a cyst, and a pocket of liquid due to endometriosis is an endometriotic cyst. If it's larger than 3 centimeters in general, it's an endometrioma, or what we used to call a chocolate cyst, because the blood becomes darker. It looks like milk chocolate. The ultrasound will reveal if there are any accumulations or pockets of endometriotic blood. So if there are cystic changes. If there are cystic changes, those changes are often on the ovaries. And if not on the ovaries, they are sometimes on in front of the uterus or behind the uterus. So if the ultrasound reveals endometriomas, then those will need to surgically be removed. They will not go away on their own, and over time they will always get larger. So the management of suspected endometriosis is obviously an exam to see if you feel anything unusual, and then an ultrasound to see if you see anything unusual. If you do, then confirmation that looks like an endometriotic cyst is made with surgery, and that's usually a laparoscopic cystectomy. So we put the camera in with instruments and day surgery and remove the cyst wherever it may be. And as I stated, usually that cyst is going to be on the ovaries. Now, if the sonogram is done and there is not evidence of endometriotic cyst or endometriomas, then that lady is deemed to have microscopic endometriosis, and she's simply placed on birth control pills. The birth control pills will suppress ovulation. They'll suppress the hormonal stimulation that occurs. Take another view. They'll suppress the hormonal stimulation that occurs. when after ovulation, and it will always decrease the pain. For most women, it will decrease the pain significantly. So it will decrease the pain at least by about half, 50%, 50% to sometimes completely, where the woman does not need to take pain medicine at all, and where she simply needs to take 1 or 2 tablets the day before or the day of the menstrual cycle, and she's good, whereas before she was debilitated. So it makes a huge difference as to whether or not someone's on the birth control pills. Now, most women will be managed or maintained just by taking the birth control pills. I always tell the patients they have to give the pills 6 months to see how they respond to them. The first 3 months is to see if they have any side effects. But in reality, most women will notice a huge difference within 1 month of doing the birth control pills. It's not common, but every blue moon, someone either doesn't respond well to the pills, or they do respond well, but within about a year or so, they start to lapse. So the pain starts to come back, and then it starts to become unbearable. If someone has a relapse from the pills, then we just do one of 2 things. Well, we'll always do another sonogram to make sure nothing's changed, and then the options are to do an exploratory laparoscopy, where we simply look with the camera to see if there are any areas of endometriosis that we can destroy or ablate, and that means we go in with the camera, and either with cautery burning or with laser burning, or with excisional biopsy, we remove the visual evidence, any macroscopic evidence of endometriosis, or we just destroy macroscopic evidence of endometriosis. That will alleviate the patient significantly for at least several months. And then either, if people do the surgery, they will either place her back on birth control pills after the surgery, or they will put her on a hormone suppression therapy. It's called a GnRH agonist, so gonadotropin releasing hormone agonist. And what that does is it puts the patient into a temporary menopause. With the temporary menopause, that was the end of her competition. With the temporary menopause, it suppresses the hormones completely. So we know endometriotic stimulation is due to ovulation and estrogen surging, high estrogen levels, naturally high estrogen levels. So the menopause medication, either by shots or pills, puts her at extremely low to nil estrogen levels, and at extremely low to nil estrogen levels, there's basically starvation of the endometriotic changes. So some people will do the surgery first and put the patient on the medication. Others will just put her straight on the medication, provided the ultrasound reveals no changes. And then it's 6 to 9 months of that medication, and then back to the birth control pills to maintain the efforts that were achieved. So I think that's a wrap. So this is Dr. McDaniel at GYN Corner. Check out the YouTube channel. It's also called GYN Corner. And I'm here at Baymar Farms Saturday. The girls usually do their horse lessons on Saturday. We forgot that there was a competition today and there wouldn't be any horse lessons. So we showed up. But it's just this competition, so the girls are walking our dog, our Yorkie, around, because the Yorkie loves coming to the farm and hanging out, walking around. So Joy walked the Yorkie, and then in August the girls will be doing a competition. These competitions are fairly expensive. The competition is worth about 5 lessons. We've been coming here since 2000, since 2010? Since 2011, since early 2011, since my daughter Jill was 5, she's been riding here. And because they've been coming here so long, they're not expensive for us, but for the 2 girls, it's $90 a week. And for a competition, if we do just the bare minimum of classes, it's about $500 for one day. So that adds up. I mean, some people do these competitions every month or every couple of weeks, really, because you can do them at other horse farms. You can travel around, do them at other horse farms, or you can just do them at your own horse farm. We only do the ones at our own horse farm. The girls are just taking the lessons just because they enjoy riding the horses. They love animals. They're not doing it because they're hopped up and want to compete. And they have a bunch of ribbons just from having done the competitions for once a year for so many years. They have a bunch of ribbons and a couple of trophies. But as the years go by, the people who are taking lessons every day, some people take lessons every day, or they get a horse. Horses are cheap to buy, it's just expensive to maintain them. They'll get a horse, they'll keep the horse here at the farm, and then they're coming in every day or twice a day, in the morning and the afternoon riding. Once the girls have started getting older, they're competing with, these girls ride 30 minutes once a week. They're competing with people who are riding 1 to 2 hours every day and competing every couple of weeks. So it's difficult for them to place well. They'll usually get like a 3rd, 4th, or 5th place, and they're happy with that now. It's not a big deal. It's just for the fun of it. But we'll be back next week. There isn't a competition. They'll be taking their lessons. So this is Dr. McDaniel, GYN Corner, slice of my life. It's I guess it's close to 8:30 or so now. I talked a long time today because I was trying to finish up the endometriosis. Tomorrow's Sunday. I don't know what I'll talk about tomorrow. I'll come up with something, think about the week. Everyone have a great rest of the day, and enjoy the weekend.